development meeting there. All right, we continue with the news this morning. We're going to be, as we did allude earlier on, we're going to be talking a lot about health is wealth. And at this particular juncture, we're talking about oral health. Now, according to the World Health Organization, oral health is a key indicator of overall health, well-being, and quality of life. Being a Thursday, and since it's our Health is Wealth segment, we would like to discuss the importance of good oral health. And we do have in studio a dentist, Dr. Farayi Moyana, here with us this morning. Good morning, Doc, and welcome to Good Morning Zimbabwe.
Good morning, Mangwanani.
Mangwanani. Firstly, let me start by congratulating you on your attainment of your PhD. Makorokoto Mhlope.
Thank you, to not end.
Fantastic. Now, maybe if you can just, as we get into that, what did you specialize in and what was your thesis topic on?
Okay, thank you. My PhD is located in a discipline called Bioethics and Health Law.
Right.
In a nutshell, it deals with the advocacy of patient rights, analyzing health inequalities and trying to craft policies that address those challenges rather. My thesis is entitled Towards an Ethically Justified Model for Access to Healthcare in Zimbabwe. It's a 10-chapter thesis, 300 pages.
Wow.
And in that document, which I recommend health policymakers to read because it's on the internet. Just have to log in on any search engine and you'll be able to read. I did a groundbreaking model called the citizen-centered healthcare model, which I think it can help us to understand and probably solve some of our problems in Zimbabwe.
Absolutely. Fantastic. I'm definitely looking forward to going through it and reading it as well. Now, let's get back to the actual core of oral health and maybe just defining it. What is meant by the term oral health care, and why is oral health so important to us?
Oral health is important to us because the mouth, as you know, is the gateway to the body. The mouth is the identity of the person.
Right.
Try and imagine a face without a mouth.
Oh dear.
You probably not even recognize who it is. But more importantly, the mouth allows us to function in everyday activities like talking, smiling. I can see us smiling.
Yes.
Very, very well because you've got beautiful teeth.
Thank you.
Healthy gums.
Yes.
So, and in addition to that, we need to eat. We need to chew properly. We need to smell good. And we need to swallow, and so many other functions. If those functions are disturbed, then we become dysfunctional. So oral health is very important, and it's also a reflection of your general well-being. If I may just add, in most cases, a dentist may be the first person to actually pick that your health is deteriorating. Diseases such as diabetes, for example, can be picked in early stages by a simple visit to your dentist.
All right. Fantastic. So maybe let's look at some of the major oral health challenges that people have, especially here in Zimbabwe. What have you come across in terms of the diseases that are normally found by U.S. dentists?
Thank you. The commonest diseases are commonly referred to as plaque-induced dental diseases. This is one, tooth decay, cavities, or dental caries, otherwise known as dental caries. And then secondly, gum disease, which if not picked up early, can deteriorate or complicate in what we call periodontitis. This refers to the destruction and stripping off of the supporting structures of the tooth. And in later years, in older age, people lose teeth where they just become loose, and in most cases, dentists have little to do to keep them in the mouth.
Okay. And what causes issues like bad breath and tooth decay?
Thank you. That's basically the most important thing that we need also to raise.
Yes. And
the commonest thing that people complain about. Why is my breath smelling horrible? Try and imagine something rotting. Whenever protein decomposes, it gives smell.
Yes.
So bad breath is basically as a result of things deteriorating in the mouth. Could be food collecting in between your teeth or inside cavities, and you can't remove it properly. so it decomposes and gives a bad breath. And more importantly, the supporting structures of the teeth that I've mentioned, the bone, the fibers that make your teeth strong, if they deteriorate and decompose, they give a horrible smell. So visiting the dentist, in as much as you might be very good with your hygiene, once in a while, it's very important, because there are certain things that you won't be able to manage on your own, especially the deposits, the hard deposits that we need to remove. And also, just to recap and to re-motivate you on your oral health care methods like flossing, brushing, disclosing where the areas that you're missing, broken fillings, and more importantly, oral cancer. I must have mentioned that when I talked about the disease in the mouth. Oral cancer, it's one of the most devastating problems that we meet, because by the time it's discovered, sometimes it could be late. And it's painless, it's insidious, and as a result, people don't go early enough.
Right. Doc, one of the things that also you alluded to a little bit earlier on is the issue of, poor health being easily identified. Please just kindly elaborate more a little bit on that. You spoke about easily identifying patients with suffering from diabetes and other ailments. How is that actually seen when you're looking at someone's teeth?
Okay. So a dentist can raise a very good and sometimes very reliable suspicion by generally looking at your mouth. If everything else is okay, and yet we witness loosening of teeth, bone loss, in an otherwise clean mouth, often it raises a big suspicion. It could be anemia, it could be diabetes, it could be some other issue in your body.
Yes.
So we work in a multidisciplinary approach, which means then we liaise with our medical colleagues.
Absolutely.
Yeah, sometimes we do basic tests like full blood count, just to get a view of the patient's blood, for example, and then we refer.
Fantastic.
And that can actually prolong life, and also early detection of otherwise conditions that could have gone unabated for many years.
Absolutely. Doc, as we draw to a conclusion of our interview this morning, tell us about the new dental nursing program. This is something very exciting that's new on the market.
Thank you very much. So as a profession, we realize that our foot soldier, I often refer to them as the vanguard of oral health.
Yes.
This is the dental nurse, otherwise referred to as this dental surgery assistant. They were not catered for in terms of formal training, and yet the rest of the team members have training in Zimbabwe.
Yes.
We have training for dentists, dental therapists, dental technicians, and even dental specialists. We are now training oral and maxillofacial surgeons and orthodontists, but the dental nurse was uncatered for. So we came together and approached the Ministry of Higher Education, and we got an approval to train a 2-year national diploma in dental surgery assistant. That was the birth of the Zimbabwe Academy of Dental Nursing. And all the details are on our website, www.zadenu.org.
Fantastic. And besides that one, if we want to get in touch with you personally, where can we find you?
You just go on the internet.
On
Just
the
type in Farayi Moyana.
Are you the only Dr. Farayi Moyana? There might be another Farayi somewhere.
No, it will only be me. There's even pictures and everything.
Oh, fantastic.
Okay.
Doc, thank you so much for coming through this morning. Really, really excited that you have come through and shed some light on oral health care and why it's important. And I'm extremely excited that you said my smile is very, very beautiful, because we do like to smile and show off our beautiful teeth right here on Good Morning Zimbabwe. Thank you so much for joining us.
Thank you. Tinotenda, tinobonga.
Siyabonga kakhulu. Thank you so much. Well, we've just been speaking to Dr. Farayi Moyana, who has been telling us about oral health care and why it's important for us to make sure that we do visit our dentist regularly. Don't just go once a year. Please make it a regular visit. You never know what you may pick just from your mouth, because remember, he did say that the mouth is the gateway to the entire body, and that's where you find where you can easily pick if there's a problem with your healthcare. Well, that's what we have for you for the part 1 of healthcare.